Hi class, this is Dr. Heather Austin Robillard, and welcome to the second part of the Special Populations lecture for older adults with eating disorders. While eating disorders are primarily thought to be most representative of young women, we are finding that it is developing or being maintained in later life as well. We will discuss the ways that eating disorders impact different stages of adults. The causes of eating disorders in older adults are not well documented or understood. The main reason being that there is a general misconception that eating disorders only affect teenage girls. However, there is growing evidence to show that eating disorders aren't exclusive to people under the age of 30. Clinicians are reporting seeing an increase in those seeking out treatment that are in their 30s, 40s, 50s, and even 60s. Research shows that eating disorders can be triggered by periods of reproductive hormone change, such as puberty, but like puberty, perimenopause is also a time characterized by shifts in hormone levels. Because of this, some researchers hypothesize that the hormone fluctuations that occur in perimenopause could also be a risk factor for the development or maintenance of eating disorders in midlife in women. Some of these factors that trigger or influence eating disorder development in midlife could be the empty nest syndrome, aging in the current American society, menopause, pregnancy, divorce, different medical diagnoses or issues that might arise, or changes in their functional domain. In the risks of eating disorders happening in midlife, we primarily categorize it into three different reasons why individuals might struggle with an eating disorder during midlife. The first is that they have already struggled with an eating disorder for years and haven't sought treatment for it, so they're continuing to struggle with it in midlife. The second is that they had an eating disorder as a teen or a young adult, and then they've relapsed into midlife. And the third is that they didn't even develop their eating disorder for the first time until they were in their midlife. The older you get, the tougher it is for your body to bounce back from eating disorders. The devastating effects of eating disorders make them even more dangerous for older adults. And for those who have been chronically ill with an eating disorder for many years, the effects may be even more heightened. The full range of potential medical consequences associated with eating disorders can include osteoporosis, increased risk of blood pressure, increased risk of diabetes, heart problems such as arrhythmias or heart disease and heart failure, anemia, cognitive problems, electrolyte abnormalities, or kidney issues. Additionally, body image has become an issue that is a common feature among eating disorders and seems to become even more complex with age, particularly in cultures in which youth is presented as the standard of beauty. Over time, we've noticed that older adults have shown to trend towards body dissatisfaction as they age. Age-related weight gain and changes in body composition, including an increased body fat, reduced skin firmness, fat redistribution, and just a change in body shape, along with decreased metabolism. This can cause women and possibly men as well to feel dissatisfied with their appearance, which can lead to unhealthy eating habits or dieting. The areas in which body dissatisfaction can span across the age include a desire to be thinner, concerns about their eating and their shape, body esteem, satisfaction with their appearance, marital status, education level, race, occupational status, does not necessarily mediate body dissatisfaction in older adults. More than 20% of women over the age of 70 are dieting, and 70% of women aged 30 to 74 have shown dissatisfaction with their weight, despite being a normal weight. 62% of women over the age of 65 wanted to lose weight, and 31% of them had dieted recently, even though 62% of them were at a normal weight. Very little is known about the prevalence of midlife eating disorders in men. However, what we do know is there might be a lifetime prevalence from ages 45 to 59-year-old men based on supplemental data from the U.S. National Comorbidity Survey, where there was a prevalence rate of about 0% of anorexia, 1.3% of bulimia, and 2.7% of binge eating disorder, respectively. The 12-month prevalence rate for eating disorders in midlife for older males was estimated between 0.2% and 1.6%. Among young males, a version of muscle dysmorphia tends to be more common than anorexia. It appears to be the same with middle-aged men as well. One study of middle-aged men with eating disorders showed a significant percentage engaged in excessive exercise, which can be very risky in this population because it can contribute to falls and fractures. Recent statistics for older adults show that 13% of women over the age of 50 struggle with some kind of eating disorder. This could be an issue of aging, increasing nutritional deficits, and eating disorders. Generally, though, there is a decline in disordered eating attitudes and behaviors over time, but certain aspects like dieting remain. Dieting and body dissatisfaction is present in people who are mostly normal weight. Eating disorders should be considered in older people with weight loss, weight phobia, or vomiting. Additional signs that may help identify an eating disorder can include an increase or decrease in weight over a short period of time, changes in their behavior, the use of laxative, diet pills, or diuretics, a desire to eat alone, maybe avoiding meals, or physical signs like hair loss, brittle nails, or dental or gastrointestinal problems, and then also the appearance of anxiety and depression. The rate of unintended pregnancies is in fact higher in women with anorexia nervosa, perhaps due to the belief that contraception is unnecessary. Women with anorexia nervosa appear to have higher rates of miscarriage, prematurity, slower fetal growth, and low birth weight babies. Women with binge eating disorder have higher rates of miscarriage and an increased risk of higher birth weight. Pregnancy and eating disorders can be associated with some women who elect not to bear children in order to avoid weight gain. For some women with body image issues, pregnancy can be a freeing time for them. But then they may have pressures to return to their normal body weight after delivery. Women with higher body image issues after having a baby may experience an increase in their eating disorder symptoms. Just as pregnancy can impact the course of an eating disorder in a variety of ways, so too can postpartum period. For women whose symptoms improve during pregnancy, two different postpartum patterns have been observed. Some will continue to show a decrease in eating disorder symptoms following the birth, while others relapse back into their eating disorder. The period after a woman has given birth is a high-risk time for the reoccurrence or exacerbation of eating disorder symptoms, especially in those symptoms decreased during pregnancy. Women experience tremendous pressure to return to their pre-pregnancy bodies and weight. This pressure can especially be distressing to those with an eating disorder. A study in 2013 found that perimenopausal women were significantly more likely to report symptoms of an eating disorder compared with premenopausal women. Further research in 2016 also concluded that perimenopause women are at a higher risk of eating disorders to develop or to return. When it comes to menopause, here are some of the examples of symptoms. Their weight becomes redistributed. Menopausal women tend to be more dissatisfied with their bodies, and they don't cite one area of their body in particular. They're just dissatisfied with it as a whole. And the research is unclear whether this is correlated to menopause or the aging process in general. A number of these symptoms are due to falling levels of estrogen. We have estrogen receptors all over our body, and as estrogen falls throughout perimenopause and menopause, there isn't as much estrogen to latch on to all those receptors. This is the end of this lecture video. We talked about research surrounding this special population of eating disorders, which is the elderly or older adults. Because different life events can happen in midlife, the body changes and can trigger certain eating disorder symptoms. It's important to understand how eating disorders may look different among the older population.